Just briefly about age-related macular degeneration, which is on 397 and 98. There are main reason for central vision loss in the elderly, and it is irreversible and it is progressive. It does tend to run in families. There's two forms, what we call the wet and the dry. Non-exudative is what we call the dry, and exudative is what we call the wet. So the dry form is slower to progress and is more common and produces what we call drusen. This is often how it's diagnosed. And drusen is a collection of yellowish extracellular deposits on the retinal pigmentation that's often noticed just on a normal routine eye exam. And then the wet is more severe and rapid. When we're looking at these, the wet, as I said, is diagnosed by abnormal blood vessels, and these are seen on just a routine normal eye exam. People often go in complaining that their vision is blurred, it's distorted, especially centrally, it's darkened. There's certain areas where they have darkened vision and even have blind spots. Really, for both of them, there's no cure. As I said, it's irreversible. They encourage vitamin and mineral supplements for both forms. For the wet form, the exudative, there is a laser photocoagulation, photodynamic therapy, and drugs that they can actually inject to slow the progression. They cannot stop it, but slow it. We've pretty much been over this slide. The only thing would be is that we were talking about injections for the wet form. That's of a growth factor that actually slows the process of the vision loss in the wet form. And then the photodynamic therapy actually destroys the abnormal blood vessels. And in both forms, the patient is advised to quit smoking. Okay, glaucoma. Glaucoma. We're on page 398 if you're following along in your book. Glaucoma is a group of disorders that cause increased intraocular pressure, and this increased pressure leads to destruction of the optic nerve, peripheral vision loss, and is the second leading cause of blindness in the United States. Two forms of glaucoma: primary open angle, most common, slow onset, no signs until the majority of your vision is affected. And you have what we call an outflow of aqueous humor, is obstructed in the trabecular meshwork. I'm going to try something new here, bringing in a picture. Let's see. Okay, here's the picture, so you can see what would be a normal outflow of the aqueous humor. But you can see over here the angle is closed right in here, obstructing, and so therefore this blockage causes the substance to not be able to get out. Acute angle closure glaucoma has a sudden onset, excruciating pain in or around the eyes. The pain is so bad it causes nausea and vomiting. There's often visual disturbances such as blurred vision, seeing halos, colored halos around lights. Sometimes the patient has had a previous episode of the same type of signs and symptoms but didn't realize that it was glaucoma, and possibly went to the doctor and had it diagnosed. So diagnosis is based upon the fact that you have increased ocular pressure. Normal is 10 to 21. You guys do not have to remember these norms. You can see an open angle, it gets up to about 22 to 32, but when we get into the acute angle, it can be over 50. And acute angle is episodic. Okay, treatment. Drug therapy is the primary focus. We're going to put them on drugs to help keep the intraocular pressure low, mainly because we don't want to develop optic nerve damage. And so drugs. And the drugs are on page 400. Oh, that's interesting. I'm writing with my right hand. And good news is you'll recognize these drugs because the first two drugs that are listed are beta adrenergics and they end in LOL. And so the only thing that you have to learn is that they decrease intraocular pressure and aqueous humor production. Then we get into the alphas, same thing. They also decrease the IOP and aqueous humor production. And then we get down into what we call the miotics, and the miotics actually also decrease aqueous humor production, and they also help with drainage, facilitate the outflow of the substance. And then we get into their carbonic anhydrase inhibitors. These are actually oral medications. So these are oral medications. Probably the most popular one is the Diamox, and they also decrease aqueous humor production. Drug therapy fails, then there is what we call an argon laser trabeculoplasty. An argon laser trabeculoplasty. It just helps to create a channel or an area in through which the aqueous humor can actually drain and keep the pressure down. Majority of the time it's successful. It is done under local. It is an outpatient procedure and has fairly good results. There are times for acute angle, which is considered a medical emergency, that when they come in, we have to give them actual IV diuretics that would help, that would actually help decrease the intraocular pressure. They can possibly also have to have what we call a laser peripheral iridotomy or just a surgical iridectomy. And essentially what this does is it is long-term treatment used to prevent subsequent episodes, and it allows the substance, the aqueous humor, to flow out through a newly created opening in the iris, so we don't have that increase in intraocular pressure. Nursing care. Obviously, these guys are at risk for injury because of their decreased visual acuity. So, a goal would be to keep the intraocular lens pressure down, so we wouldn't have damage to the optic nerve and have a greater visual deficit. So these guys have to realize this is lifelong. It needs to be understood that there is a genetic component. So if glaucoma runs in your family, you need to get your eye exams. And it is currently recommended that people have eye exams every 2 to 4 years between the ages of 40 and 64, and after 65, every 1 to 2 years. Also, that it's genetic, and so if you have a family history of glaucoma, eye exams might be recommended at a more frequent interval. Self-care deficits are obviously related to decreased visual acuity too, so we want our goal to be there's no progression of the disease, and that we teach them about the different visual aids that we've already spoke about when we were talking about someone who had decreased visual acuity with blindness. Acute pain is more so related to the acute angle glaucoma, and it would need to be treated. Non-compliance would be related to the fact that this is an inconvenient, it's lifelong, there are side effects of the glaucoma medication. But it is a chronic condition. They need to understand the disease process, why they have the drugs, the therapy that they have, and that if we can prevent further damage to the optic nerve, then we can limit the amount of visual deficit that they develop.